So there are 51 tenants who live here. And really the idea about this was to shift our thinking around the homelessness crisis towards it also being a health crisis. And what we saw at UHN when we were really taking this on a number of years ago was to look at the data. And it was very clear that around 100 UHN patients made up over 4,500 emergency department visits. You can't really disconnect the two. The fact that there are, thousands of people languishing in hospital beds because they don't have access to housing or supportive housing. And we've seen, again, the realities in a shelter system that's also at 105 or 110% capacity, where just today there will be 200 to 250 calls to the shelter system that'll be unanswered for people because there's no capacity.
We look at cost impacts on the system. If you're looking at that specifically, it's roughly $32,000 a year to support somebody who is going in and out of the hospital system. About $8,000 a month, if you will, on people going in and out of the shelter system. This is roughly $3,500 to $4,000. It is high support, but it's a much better environment, much better model of care and housing that marries both clinical support and housing support under one roof.
Every day was a struggle. I didn't eat, take care of myself. Often I couldn't. I did a lot of things that I'm not proud of. That I hurt a lot of people, and I needed to feed my addiction, and I did that however I had to do it. I remember first coming to get to see the place, and I hadn't signed papers yet. I had to sign when I got here. And I remember sitting here and I couldn't believe it was mine. I was waiting for it to fall apart somehow, and it just, and it didn't. And I get up every day happy, and I'm thankful for the gift of being stabilized and having this place.